What do you do when you experience an emotion that is unwanted? Do you sit with it? Do you ignore it? Do you fight it away? Maybe you wallow in it. How might you identify and also manage some of those emotions? That's going to be the crux of our conversation today. Welcome to Your Time to Come Alive. My name is Valerie Hope, and I am your host. I'm excited that each week we have a wonderful opportunity to meet and interact with somebody who will help us to be more conscious, more connected, and creative. This week is no different. I have a wonderful guest. His name is Skip Mondragon. And Skip and I met, it's probably been about a year now, Skip, if I'm not mistaken, when you magically appeared at a Toastmasters meeting, Fiesta Bilingual Toastmaster, shout out to that group, the club which I'm a president, and you came in as a club coach to help us grow. I think what really struck me the most about you, Skip, was, first of all, incredibly enthusiastic, high energy, and you did a speech during one of our club meetings where you talked about your wrestling background, and you seem so classy and so refined that, and you embodied your wrestling persona, and it was just a hoot. We loved it. We absolutely loved it. And not only that, but as I've come to know you and your passion, you're also very highly skilled. You're a physician. You were in the military for many years, an officer in the military. And so I am so grateful that you have brought not only big personality, but big knowledge, big skill to my life and to the life of those in our club and those that we know. And then you're now here today, bringing all that to Time to Come Alive. Welcome to the show.
Thank you, Valerie. It is my delight. I have been looking forward to this for a period of months now.
I know we talked about this a while back. So
I am so
finally
excited to share with your guests.
Oh, I love that. One of the things that obviously what I shared about you does not begin to cover who you are. What would you like for my guests and our guests to know about you?
Well, first and foremost, I am married to the lovely lady by the name of Sherry. I married Sharon Jane Cooper 39 years ago on May 30th. I met her at Oral Roberts University in August of 1978. I went there with no intentions of being involved with a girl. I said, girls, who needs them?
Sounds like heartbreak.
Indeed, I had been very much in love with a young woman, and when that relationship ended, my heart indeed was broken, and it had taken a period of years for it to mend, and it had recently been mended. And I thought, when I went to Oral Roberts University as a transfer student, I had started my college career at the University of Notre Dame, been out of school for a few years, and now was transferring to Oral Roberts University. And my thought was, girls, who needs them? They take your money, they take your time, and they take your heart. And I thought, money? What money? I didn't have any. Time? Forget it. I got to study and get into medical school. And heart? No way. I am not giving my heart away. I met Sherry my first week at ORU, and she messed up my plans.
Darn that Sherry, how dare she? Okay, so you got to tell us, what was the moment where you realized that your plans were shot?
Well, it was an evolution in terms of that. Early on, we were the respective study chairman, if you will. Study chairman, love? Academic chairman on our brother sister wings. In those days, the ratio of men to women at Oral Roberts University was almost exactly 50-50.
Mm.
And they paired up each men's wing with a respective women's wing, and we would do activities together, typically sit together, share meals, go to games together, once a semester go on a retreat together. It was an opportunity to spend a lot of time together. And we were the academic chairman for our wing. So we would get together, plan study groups, and pray for our wingmates. And within a few weeks, I saw her heart, her love for God, her kindness and compassion. And wow, I saw this lady is smart. I mean, really smart. And I was attracted to all of this. Not to mention, she was pretty good looking too. And so it was all of this combo. And I thought, And we just started spending more and more time together. We'd often linger with folks after supper, drinking coffee, chatting, laughing. And then we started going to Friday night chapel together. And within a matter of months, I was very much in love with this lady, and I asked her to marry me. We knew it wasn't going to be possible for a few years,
Mm.
and it, we got married after Sherry finished a year before I did, even though I transferred in as a junior and she was a junior. ORU requires a lot of specific general ed courses that are unique to Oral Roberts University. And I had a lot of credits going in. So it took me 3 years to finish up. Sherry graduated a year before me, went on to grad school. So after I graduated, then we got married.
Wow. So clearly that was the beginning of very many things. I mean, 39 years later, when you think back to who you were at that time in your life and who you've become, what are some of the highlights?
What are some of the highlights? Wow.
Yeah.
Well, I remember I had applied to a HPSP scholarship with the Army, Health Profession Scholarship Program. I didn't have a way to support a wife, yeah, as a medical student. I hadn't a way to pay for medical school either, and I didn't want to go into debt. So I applied for this scholarship. I had had early admittance to the ORU School of Medicine. So I applied to this scholarship, did receive it, and then let me just back up a minute, Swan. I received the early acceptance. Sherry ran around with the acceptance letter saying, "We're going to medical school. We're going to medical school." And I told her, honey, before all else is said and done, that will be the understatement of the year. And then when I received the scholarship, then I could say, okay, honey, now we can schedule a wedding because now I know that we can get married and it will be, we'll be, we're not going to live high on the hog by any means, but we can get married. And with her fellowship and that she had at Tulsa University and the paltry sum that the Army gave me, we were able to afford getting through medical school debt free.
Oh, wonderful. Look at that. She definitely got your time. She got the money.
And she
And
got
she
my
definitely
heart.
took that hard. Oh, that's
And, and medical school was rigorous to say the least. Made some wonderful, wonderful friends and had some magnificent professors. Residency was brutal, but again, uh, wonderful teachers there. Mentor, Dr. Andre Ognebin, who was a retired brigadier general, former commander at Brooke Army Medical Center in San Antonio, whom I was horribly intimidated by for the first several weeks that I was around this man. I'd go to say something, he'd ask a question, I'd go to present, and I felt that I was saying, I'd come home at night and oh gosh, I'd tell Sherry, he must think I'm the most idiotic intern he has ever seen. I was doing a rotating internship, uh, a transitional, where you spent a few months in uh, different uh, different disciplines with the idea of going on to physical medicine and rehabilitation. But I fell in love with internal medicine, adult medicine. But I went to Dr. Ognebin, or as we used to call him, Dr. O, the big O, or just sometimes D.O. And I went in and I said, Dr. Ognebin, may I speak with you? And he said, sure, Skip, come on in and have a seat. And I said, Dr. Ognebin, I'm interested in internal medicine. And he said, oh? And I said, yes. But I'm concerned because I don't know if I could be a good internist. And he looked at me. Usually he'd peer down at you with these glasses, but he looked at me and he said, Skip, I think you could be a good internist. I think you could be a very good internist. We'd love to keep you in the program and have you graduate with us here. And so I stayed there rather than doing my transitional year and going into the Army. So I graduated and learned under Dr. Ognebin, the most amazing bedside clinician, perhaps the most amazing doctor I've seen in action in all of my career.
Bless Dr. O.
Yes, bless
There you go.
Dr. O.
So,
And
Skip,
then we, go ahead.
I wanted to, before we move through your medical career, why medicine? Obviously you invested so much time and energy, and you and Sherry were a team making sure that you got through medical school and then obviously moving into internal medicine. But before all of that, why was medicine where you were aiming towards?
That's a great question. Going through high school, I was an excellent student, and others would tell me, you should be a doctor. You should be a doctor. My thoughts were, are you crazy? They work too hard. I was thinking about physical therapy, something along that lines, because I saw the life of doctors and I thought, damn, they work so hard and so many hours. It's a difficult life. And so I had in mind physical therapy or something along that lines. However, as my senior year rolled around, I began to think, it's a much easier step if I went pre-med and didn't get into medical school rather than thinking about physical therapy and trying then to get into medical school. And with that, it was also the sense there that it would be a wonderful way to blend the idea of service and science with caring for others with the love of Christ. So this blend, if you will, of science and taking care of people with the gifts God had given me.
What was it that people saw in you in high school that they felt medicine was the way for you to go?
Wow. I think it was my academic prowess, my care for others, that I was a kind person,
Mm.
that I was very diligent worker. I understood I'm not as necessarily as smart as some of my classmates, but I outworked them. I outshone them. I would outperform them. And similarly with my wrestling career, I wasn't as gifted as a lot of other wrestlers, but you were not going to outwork me. And therefore, I outperformed many, 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 many wrestlers, many fine wrestlers,
Mm.
because I was willing to work hard. And so I was so diligent and so dedicated that perhaps that's what they saw. That's Nobody's ever asked me that. So I guess I never thought about it.
Well, they clearly saw something if they were really aiming, they were really helping you move in that direction. I gotta admit, Skip, yes, intellectual prowess, I absolutely see it. I obviously, in my experience with you in Toastmasters, you're so eloquent. I can see your kind heart, your willingness to help people. The wrestling really threw me off. Really threw me off when you actually spoke about it and shared your passion for it and the experiences you had. How did wrestling come to be such a important part of your life?
Oh, wonderful. I grew up and my father was ill with mental illness. He came back from Korea, a broken man. My aunt, my Auntie Mary, his older sister, my older cousins who knew him well, those who knew him say he was the man that came home was not the same man that went to war. And the only thing my father would say when he would visit was, "Son, I hope you never have to go to war. Son, I hope you never have to go to war." He, in my mind, based on his behavior, I believe he had bipolar disorder and would become psychotic.
Mm.
He was given the diagnosis back then by schizophrenia, but I can remember deep, deep, deep morose. He'd become morose and could lock himself in a bedroom for a matter of weeks, wouldn't come out, lights off, just smoke in there and never come out. He would be in and out of the VA hospital, and we didn't see him much when I was growing up. That being said, I'm the third of 8 children, 2 older sisters, 4 younger brothers, and a younger sister. So my mother, with my little grandma, mi abuelita, they raised us. Thank goodness for my abuelita. She was the stabilizing force in the midst of a lot of chaos. I was very small for my age, typically the smallest kid in my class. We moved a lot. So I was the new kid on the block. I was marginalized. We moved to different areas. Being Hispanic and being the new kid on the block, being very small, I was bullied.
Mm.
It didn't help because, at least when I was growing up as a boy, your status was oftentimes based on your athletic prowess.
Mm.
I didn't know how to catch, kick, throw a ball. Like, I mean, I failed at tetherball.
I failed at tetherball.
I rem- I remember in fourth grade, my mother was teaching on the Zuni Indian Reservation, and every matter of months, our teacher would take us out to the chin-up bar, and she would test the boys on chin-ups and the girls on bent arm hang.
Oh, those are hard. Those are hard.
So the guys would get up there, and what I don't realize, what I finally realized many, many, many years later in retrospect, is a lot of the boys were older than me. Uh, but that being said, boy, some of the guys get up there and do their pull-ups. There were 2 of us in there, who, one kid and myself, and I would dread when my name would be called and my teacher would call Skip. I would just, so I jump up to the lowest bar and I grunt and kick and pull and, with all my might. And I couldn't do one pull up. And so the shame and the snickers and the laughter, uh, that would go on. So this lack of prowess in any kind of physical activity. I couldn't run well. None of the sports, basketball, football, you name it, I wasn't good at it. I didn't have an older brother. I didn't have a dad. I didn't have anybody to teach me those skills. And then when I was 13, my mother had remarried. We had moved back to Denver, and things became much more stable. I went out for the wrestling team. And for the first time, I would compete against guys my own size. And after a few practices, I thought, I can be good at this. I think I can really be good at this. And I just went all in. And I started beating kids on the mat. In fact, I was the only 8th grader that made the varsity team.
Wow.
The 85-pound class, mind you. The lowest class.
Varsity is varsity, Skip.
That's right. Now, I want you to know, even though I was a very good wrestler and even a better wrestler in 9th grade, I'd get so wound up the night before matches that I'd spend the whole night tossing and turning and thinking about the match that I wouldn't get any sleep, that I'd drag in the next day and couldn't perform. So it took me 2 years before I won my first match.
Oh, wow.
Summer after 9th grade, I entered a freestyle, one of the Olympic style tournaments. And it was a state tournament, and won my first match. My first match. Won my second match. My second match. Won my third match. My third match. And then my fourth. And then I was pitted in the finals against a kid that had been the defending champion for that tournament the year before. And I beat him. So I came away with not only my first wins, but my first ever medal. And that further fueled that desire, because that's what I wanted all along. I went on from those inauspicious beginnings. I was a 2-time district champion. I was a state runner-up, and I was a honorable mention All-American in high school. And as I say, I knew I wasn't as gifted athletically, wasn't as strong, but I worked very hard.
You got in the grind. What was the impact on your relationship with the Bullies?
That's a great question. After I got into wrestling, even though I was small, I wasn't any bigger. The Bullies left me alone. I laugh. As an adult, I used to laugh and say, darn, where were the Bullies then?
You could have taken them down.
I would have gotten them on the mat. I would have given, as my little grandma, my abuelita used to say, I would have given them a good beating.
What did happen then? Why do you think that disappeared?
One, the way I carried myself, I think. That even though I was small, and I think that when you have success, and when you have success in something like wrestling, which I saw make wimps out of some great athletes who came and got on the mats. They might have been stars in basketball, in football, but they got out on the wrestling mats and they were wimps. They found out, they used to complain about, oh yeah, football and the conditioning we have to do and basketball. And they came out and tried wrestling, and then the conditioning that went on after practice. And oh my, they're complaining and whining and so forth, that you carry yourself differently. I
Mm.
think it was mainly that confidence and the way I carried myself, and they knew I wasn't easy pickings any longer. That
Ah.
they they weren't going to pick on me. That I wasn't going to stand for it any longer. It was that idea. Well, you want to bring it on? Go ahead and bring it on.
Your energy completely shifted.
Yeah.
Uh, I wanna call back to something you were sharing, how there was no one, no male figure in your family who could have taught you some of the sports, right? That to be more athletically inclined. You said so. Your father mentioned your father had been diagnosed with some mental health issues. Did what happened to your father? You mentioned that your mother remarried. What happened?
Well, my father was in and out of the VA, and he was also alcoholic in addition to his mental health issues. And eventually, my mother actually separated from him because he would abuse her. And an incident happened where not only was did he abuse her, and he would threaten her life. And I didn't find out about this till I was in my mid 30s. My mother never spoke ill of my father, ever, ever, ever. But come to find out, he would put a knife to her throat regularly and say, Esther, I could kill you. Esther, I'm going to kill you. And it got to the point where she would just finally tell him, Gene, if you're going to do it, just do it. When she was pregnant with my youngest brother, he threatened to throw out a window, 2-story window. And if it weren't for my Auntie Mary, her older sister, who was pregnant then with her youngest, that stepped in front of him and said, Gene, you're going to have to go through me. That I think he might have. But
Mm.
he would be violent. He would do this. And she said, I could endure that, but when he picked up your sister and threw her across the room, it was no more, no more. We can't live like this. So we would see him on occasion. And he unfortunately died when I was 13. He was on an experimental drug with strict instructions: do not drink while you're on this drug, and apparently did so. And
Mm.
there, but my mother had already remarried the year before. And of interest, my daddy, my stepfather, had been friends with my dad before he had met my mother.
Mm.
They were all high school classmates. And in fact, in high school, my daddy had asked my mom to marry him, but my mother said, Larry, no, I'm in love with Jean. So an interesting, and my daddy
Wow.
had gone through a very tragic and difficult divorce, which he didn't want, but his wife divorced him. And so they met up and they had a wonderful and blazing romance and a wonderful marriage. And
Mm. Wow.
so,
And it's, how unfortunate that your father didn't have the opportunity to see the man that you became. That's really where you took off at that age when you were eighth grade. So, you- Skip, you wrote a book called Wrestling for Depression.
wrestling depression is
Wrestling,
not for wimps.
Wrestling Depression, and it's not for wimps. So let's talk about that. What is it? So wrestling, we clearly got the wrestling. We got the medical school. Let's talk about the depression part. Where does that come in your life?
That comes in at the end of my 26-year career in the Army. Now, of note, and I didn't come to understand this until really the beginning of this year. I was on another podcast with a gentleman by the name of Al Levin, and he has a podcast, The Depression Files. And he asked a question, well, have you had depression all your life, or is this something you've contended with? Because if you would have asked me that question, I would have said no. But when I cogitated on that, I thought, no, I have had a low level of depression all my life, and just this underlying current. That being said, the last year in the Army, I suffered major depression. And I think it was just a confluence. I know it was a confluence of a lot of things that occurred in my life that finally hit a breaking point to where I was curled up under my desk in my office, blinds drawn, door locked, phones turned off, lights turned off, and asking myself the question as I lay there in a fetal position, Skip, what are you doing? Skip, what are you doing? How did you get here? And for the next 4 hours, I wrestled with that and began to look back and put the pieces together.
What were the pieces?
Horrendous insomnia, this deepening blue mood, social withdrawal, withdrawing from nature, these recurrent, horrible, negative thoughts. You're a failure. You don't deserve to be a colonel. You've let your family down. You've let the Army down. You've let your department down. You're a fake. Who's going to want to hire you? And these tapes are going over in my mind 24/7. You can imagine what it was like when the lights were off and it was dark and there was no outside distractions at night, wrestling with those thoughts, shame, guilt, loss of confidence. My joy was gone.
Hmm.
My body aches were and pains were amplified from old wrestling injuries, overuse injuries, the osteoarthritis and the muscle tears, etc. These were all amplified. The old slights were amplified, struggled with bitterness and resentment and unforgiveness, things that I thought I had dealt with over the years that I had to wrestle with every day, say no, with these things. So all of these things I began to see and realize that these had been going on and progressively getting worse. So this was on April 14th, 2014.
2014.
Correct. And I finally admitted then that I had been in denial because I'm tough. I'm a man. I'm a wrestler. I'm a soldier. I'm a war vet. Skip, you're depressed. Go get help. And that day I did go get help.
I have a question, Skip. So far, you've shared you had a challenging childhood, right? The bullying that you experienced growing up. You had a family that there was trauma, family trauma that you shared. Then you had a successful wrestling career. You met the woman with whom you gave her your wallet, your heart, your watch, right? Um, and then you mentioned 26 years in the military and then being curled up in the room with the blinds drawn and the lights off. And what you described as all these different pieces were a lot of the symptoms, right? Depression, all the experiences and the recurring thoughts. But what happened in those 26 years? Because I feel like there's a little gap that you shared about the military, going to medical school, and then at that moment in time where you're curled up in the ball. So what occurred during that time, or what were some of highlights, if you will, in those 26 years that you feel triggered some of that?
Well, we left medical school. We arrived at Fort Sill, Oklahoma on a dreary, dark, dank, chilly January 2nd, 1989. Only knew one man and his family moved into a house, and within a matter of days, I was supposed to have time to get my family settled. And very quickly, the chief of my department said, Skip, I'd like you to come to work. Now, by all rights, I should have had, I think, 10 days to get my family settled. And knowing what I know in retrospect, of course, I could have gone to my deputy commander of clinical services, his boss, and said, Colonel Leonatis, this is what's going on. I need to get my family settled. Well, being the dutiful captain and not knowing what you don't know, I tell Sherry, honey, I'm sorry, but yeah, Colonel Dowdy has asked me to come to work. So I went to work. This was a form of bullying, and that's what I understand.
Mm.
So thrust into this very quickly and busier. Sherry said, if we thought medical school was hard and we thought residency was hard, that first year in the Army was even worse, because within 5 months, one of my senior colleagues was preparing to leave for a fellowship in infectious disease, and then our most senior colleague there in internal medicine, he decided to leave for a nephrology, a civilian nephrology fellowship. So they turned around to me and said, Skip, you are now the chief of the internal medicine service. You are now the chief of the ICU, the intensive care unit, and you will be our only Fort Sill-based internist for the summer. And it was the most stressful and worst summer that I've ever experienced. It was horrendous. The stress and the sleeplessness and the anxiety it put on me and Sherry. So we weathered that. And to make matters worse, my two new colleagues coming in, one was delayed because of some academic issues, and the other was granted permissive TDY, in other words, leave by his superior, which should not have happened. That should have been granted or denied on my end, the receiving end, not by his end, because he was due to report, shortly after July. So it was, because he didn't report till, I think, the third week or so in July rather than mid-July. It might even been the end of July. So it was a horrendous summer. So that kind of experience. The next year, I deployed with the 47th Cash to Operation Desert Shield, Desert Storm. Sherry was pregnant with our fourth child at that point. We had a son born in medical school who has a rare, exceedingly rare blood disorder. It's called Black Van Diamond syndrome. There's only approximately 50 people in the U.S. that have this disease. I deployed, as I said, or I didn't say, but I deployed 4 times in total, spent 30 months in combat zones. Of course, you see trauma there. You deal with mangled bodies. You dealt with a soldier who committed suicide. You pronounce soldiers dead. You deal with this. You lose time away from your family. I lost 3.5 years out of my family's life. You don't get that back.
Mm-hmm.
Time with young children, time with teenagers, anniversaries, birthdays, other celebrations, Christmas, Thanksgiving, Easter celebration. You don't get those things back.
Mm.
And and then knowing your family's struggling, your wife's having to contend with all of this. And then the call schedule. You get called away from meals. You get called away on a Sunday afternoon. You get called away when you're playing with your kids, or you tell the kids, I'm gonna get, I could get called anytime now. And sure enough, you get called and you end up at the hospital the rest of the night. It takes its toll, that that sleep, lack of sleep, and that demanding schedule over the years, that trauma that you see, that you experience. Uh, the last year or so, we had some issues with our cardiac cath lab and our dialysis unit, uh, not because of me, but some problems there. And we were having to divert patients to other institutions because the issues there, and it affected our graduate medical education programs. And I took that on personally. And being an
Yet
empath.
another.
And then another there, I'd had 3 surgeries in 6 months that I had delayed before I got out of the Army.
Your own surgery? Like you had to have surgery?
Right. Because I had
Wow.
delayed having those.
Okay.
And with that, disrupted my routine, for a matter of weeks each time.
Mm.
And all of these things that accumulated, stress over years, those things, concerns about our kids. A son who started abusing drugs at the age of 14. He ended up spending 3 stints in the Texas Department of Corrections. Another son with some mental health issues. So you can see.
Wow. And you know what, Skip? Wow, that
uh,
thank you so much for just painting that picture for us. As you and I've spoken about this, I have a father. My father was in the military for 27 years. My younger brother was a Marine, just retired a year ago. He was in for 20 plus years. My godfather was also in the military. And it's interesting because when I've spoken with them about aspects of their military life, all of them have had very difficult situations, right? The moving, missing time with family, training. My brother was deployed 4 times. My godfather was in Vietnam. And yet, one of the things that I've noticed that none of them tend to share, at least not out loud with me, is what kind of support, like when you describe what you describe, you had a whole different level because you were the support for the military. You were in the you were in the fields dealing with the death, dealing with the injuries, dealing with the illnesses, all of that. And one thing I don't hear from the people in my life who've been in the military, it's the kind of support that was available to them to deal with some of the traumatic stress, right? What they experienced, what they saw, how they had to then lead other people. So I'm curious about, for you, having lived through all of those things, having to be the support system for other people, what type of support were you receiving, or what support did you look to?
well, primarily my faith, and I would seek out the chaplains,
Mm.
and I would seek out fellow Christian believers. That was my main line of support. And at home, I'd reach out via email, uh, and the calls when I could do that with my spouse or others, but primarily my spouse. We would stay in contact. And of course, I wouldn't share any of the details with Sherry in regards to things, but we would pray together. And but the Christian brothers there that are in the field, we would have Bible studies together. The chaplains, when they were available, I typically made good friends with our chaplains. We would share, because again, chaplains lead a very lonely life also
Mm.
when you're deployed, because they don't have a support system.
Mm-hmm.
And we became a mutual support system, which I cherish.
Beautiful.
And
Okay.
that was my main support when I
Oh,
was
wow.
deployed.
And Skip, when you think about now, you're curled up on the floor, windows, shades drawn, lights off, when you're having all of those thoughts, what was the moment where you either sought support or when you knew that you needed to do something so that you would transition out of that state? What happened?
It was finally when I could admit to myself, Skip, you're depressed. When I hit such rock bottom, I was completely depleted emotionally, physically, spiritually, because my modus operandi, my way of life had always been be tough, gut it out, work hard, just keep at it. That had been my way of doing things. But the harder I tried, the worse I got.
What
And
was it
so I,
about? Sorry, go ahead.
I got, I was just utterly spent.
Mm.
I had no further resources left. And I, I could no longer deny the fact that I, I can't do this. I'm not as tough as I thought I was. I can't do this on my own. I, I'm, I'm utterly, utterly spent.
Skip, I'm curious about something. I've not had that experience myself. So, what was it about admitting that you were depressed? What up to that point, what did it mean for you to acknowledge it or to label it depression, that you had avoided it? What was the meaning that what was the meaning behind being labeling what you were experiencing as depression that had you avoid it for so long?
I'm a caregiver. I'm and have been throughout my life. I cared for my four youngest brothers as long as I can remember. I, I'm the peacemaker and caregiver in my family. I was the caregiver for my for my extended family, if you will. I'm the caregiver for my family, for my wife, for my patients. I'm the strong person. I'm the tough wrestler. I'm the soldier. I'm the one for my team. I'm the one there for my department. I'm the one there for my patients. And that that view of myself, I'm tough. I had to finally get through that shell and that image of who I am.
Mm.
That that identity, if you will. I think it was that kept me in denial for so long.
Wow. Thank you for sharing that. And it's interesting as you were talking, although I wouldn't say that I've experienced depression, I I remember a time where, I'm the only girl, I have three brothers. My dad was in the military, mom was a school teacher, so we're like a get it done kind of family. And I also grew up kind of being the tough one, take care of business, look to for taking leadership, not only at home and at school, but in my life. And that's kind of how I've always shown up. And it is exhausting. It
Yes,
is exhausting.
yes.
And I remember after my divorce that was going to a therapist to just kind of work through some of the angst that came up with for me, and he asked me the question was, Valerie, where does the sadness go? He said he saw everything else, but he's like, what do you do with it? Because you obviously expressing all of these things that are sad, but where does that go? And until that moment, I hadn't realized that I just kind of kept it nice and tight, locked down, dealing with it, just push it through. So I really acknowledge, and I can it resonates for me what you're sharing. The great, clearly not to the extent that you experienced it with all of the other things that you were taking care of and the level of responsibility that you had. So thank you so much for sharing that. So I imagine there's a lot of people out there who are the caregivers, who are the, the get it done or the grinders, the peacemakers, who are having to take on, especially, now in the middle of a pandemic with all the racial tensions that are cropping up all over the United States, that emotions are being exacerbated, and whatever conditions were there before are probably, doubled, tripled, 10 times magnified now because of everything that's happening. So once one decides to acknowledge, right, now, and admit that depression is what's happening, what happens then? What does someone do to move forward?
Seek help. That's what you do. So once you've admitted it, get help. I went down to my primary care clinic because I knew they had a psychologist and asked for an appointment. However, the appointment was going to be for the next week. And I made the appointment. I got back to my office. I thought, I don't want to wait till next week. So I called the chief of behavioral health. It helps that I was chief of the department of medicine, and we knew each other by our first names and interacted regularly. Their privilege that goes with being a colonel. Mm-hmm. And I called him and I explained what was going on. I said, can you arrange for me to see somebody? Called back and said, arrange for you to have an appointment for this afternoon with so-and-so. And so that afternoon, I went to see this very astute and very kind and gracious clinical psychologist. That got the ball started rolling, did a very thorough intake interview, including asking questions about suicidal ideation, of course, my extensive background, my family's background regarding mental illness, addictions, et cetera, my own medical history, these type of things. And then at the end, she said, my chief and I have been talking, and we think for ongoing therapy, there's someone that we believe you'd be a great fit for, and that's Lieutenant Colonel Mike Perry. And we've arranged an appointment for you to see him next week. And Mike, Lieutenant Colonel, and I met, and we hit it off from the beginning. Mike is this very distinguished, comes in very tall, self-confident, but gracious man, African-American, and Mike and I hit it off from the beginning. He's a Christian man, a family man, humble, and he was my therapist and helped me greatly.
So you had therapy, you had support of the chaplains in
yes, and
your life.
Lots of TLC from my wife. She's always been my number one fan, always been there to encourage me, had support from family, particularly my son, or rather my brother Chris, and my mom. At recommendation of Mike Perry, he recommended that I see my primary care physician, have an evaluation. Was there anything medical going on? She did a thorough evaluation and looked for other causes, medical illnesses. There's things like hypothyroidism, other things, other underlying diseases that can cause depression. Did that, evaluated for those, came back and said, I don't find anything here. This is major depressive disorder. What do you think about medication? She said, I would recommend it. What do you think? I said, yes, I agree. So we started medication. So the medication, the psychotherapy in concert, and then eventually I did see a psychiatrist and was under their care. And then I began to put resume some things there, get back in some routines, get my sleep, because there were nights when I wouldn't hard to sleep at all, or I'd maybe get an hour or two of sleep at best,
Hmm.
and things had just gotten out of such whack,
Control.
completely out of whack.
And Skip, as we wrap up our conversation, what advice, what wisdom might you share with others who find themselves reflected in some of the history that you shared, experiences that you've had? What advice or wisdom would you give them?
If you are experiencing some of the symptoms I experienced, insomnia, blue mood, social withdrawal, guilt, shame, these horrible negative thoughts running through your mind, perhaps irritability, anger, go seek help. And absolutely, if you are struggling with suicidal thoughts, do not delay. Don't suffer in silence any longer. Help is available. You are not a wimp if you seek help. It's
Mm.
the most courageous thing you can do for yourself, the kindest thing you can do for yourself. Go get help. Don't delay. Get help. You're suffering, and your family and loved ones are suffering because you are suffering.
Mm.
Get help. There's a variety of organizations. Valerie will have those in her show notes that you can seek out for help, books, other podcasts that help you along the way. But first, see a professional
Mm.
and get started on your road to recovery. Do not lose hope. Remember, you are not alone. I got better, and so can you.
Lovely. Skip, what are you grateful for now?
I am grateful that I went through this experience.
Mm.
As I initially prayed, Lord, 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 deliver me from this darkness. And then I began to pray, Lord, what would you have me learn from this? And how might I use it to help others? So I am compelled to share this message with others. My mess became my message that I can help others. And I am honored and privileged to do so. So
Mm.
I'm thankful that I get to share with others what I've learned so that they can get the help they need and no longer have to
Mm.
suffer in silence.
Ah, couldn't have said better. Thank you so much, Skip. And we're grateful for you. Your mess being your message. I think all of us have that. Everybody has some mess, and like you said, is to learn from, is to grow from, and then to give it away. Right? Thank you so much for being on the podcast and sharing your life with us, or at least letting us peek into the windows of your life and sharing some of the more vulnerable spots, especially. I can just imagine that there's somebody out there that needed to hear exactly what you had to say, when you had to say it, and how you said it. So I'm so grateful to have had you as a guest on the show.
It's been my pleasure, Valerie. I hope we can do it again.
Absolutely. Now show us the book, by the way. Do you have the book there?
I do indeed.
Let's check it out. Wrestling Depression is Not for Wimps. Fantastic. And where do people find that book, Skip?
They can find it on Amazon. They can go to Amazon and they can type in Wrestling Depression is Not for Wimps,
Mm.
or they can type in Skip Mondragon, Mondragon, and they will find my book.
And we should also add you are a practicing physician, correct? You're
Yes,
still.
ma'am.
Yes. And so if people want to connect with you personally or be treated by you because they just fell in love with everything you just said and
Ah,
who you are, how may they get that information?
well, right now I'm between jobs, I must say, and I will actually be doing something different. I'm moved on from the Hope Clinic where I worked in Waxahachie, and I will be doing clinical research for the time being, trying to decide what I want to do when I grow up.
Hey, very good. Well, wonderful. I'm sure that either way, people will want to connect with you, if nothing else, just to understand your mess, so that makes them understand their mess to help transform it into their message.
And they can connect with me on my website at www.wrestlingis.not-for-wimps.com.
Fantastic. And I will also add that to the show notes. So in case you didn't capture it, we'll make sure you can click on it later on. Skip, once again, thank you so much for being here, sharing your story with us and your hope as well as your message.
It's been my pleasure, Valerie.
Thank you. For those of you who tuned in, thank you so much for watching Time to Come Alive this week. As usual, please make sure you subscribe to this YouTube channel, connect to Joy, so that you are notified every time a new episode is posted. And if you'd like to get it into your email inbox, go to www.timetocomealive.com and subscribe, and you will receive this in your email. Thanks, everybody, for tuning in. I hope you have a wonderful rest of the day and joining us next time for Time to Come Alive. Bye, everybody.